The Kidney Flagship is a collaboration of patients, families, researchers and clinicians with a vision to end kidney failure in childhood. And we're doing this across 5 main research themes. Firstly, we aim to empower patients and families so that they can contribute to our work in a meaningful way and genuinely drive impactful outcomes. Secondly, we want to provide an early and accurate diagnosis to patients, primarily through research-level genomics and diagnostic genomics. Thirdly, we're using the data in our electronic medical record to drive new outcomes for patients and data-led approaches to therapy. Next, we're focused on developing treatments for patients with kidney disease through our work with kidney organoids. And finally, we're hoping to grow transplantable stem cell-derived kidneys so that in the future, children will be able to receive a kidney transplant derived from these tissues. Together, we're working to imagine a future without kidney failure for children and working together as a collaborative to achieve this goal.
My name is Lisa and this is Aubrey, and she's 9 years old and she has autosomal recessive polycystic kidney disease. So I first learned about Aubrey's diagnosis when I was 32 weeks pregnant, and that was due to me having a low-lying placenta, and so we had a booked ultrasound, and we were told by a fetal specialist at the time that they thought it was ARPKD. So in the lead up to Aubrey's delivery, it was a very overwhelming experience, and we were told that we would have to do genetic testing to confirm the diagnosis.
Through our research, we've been able to deliver more tests and faster tests and more diagnoses to patients and families like Aubrey. And we've also been involved and now have access to Medicare-funded genetic testing, which only increases the reach of this testing. This has really improved access to testing and counselling services for Aubrey and families just like hers.
Aubrey's journey with peritoneal dialysis was quite a lot. She went on dialysis at 3 days old and had both kidneys removed within 2 weeks of life. And she was on dialysis till she was 3.5 years of age, where she got a kidney transplant.
There are a variety of research projects active in the clinical research stream. A large number of those are focused on transplantation. And that's really important because whilst transplantation is the very best treatment for kidney failure, we know that a transplant unfortunately won't last forever. And for a child, that often means they'll require multiple transplants to get them through their lifetime. One of the main reasons that transplants don't last forever is because the body rejects the kidney. And so we have a large focus on trying to improve this with a program called the EPLET program. This looks at trying to improve the matching between donors and recipients to make that kidney transplant last for as long as possible. This is one of the ways that we help patients like Aubrey.
So Aubrey is on medications daily to help support the kidney transplant, and there's currently no medications that can prevent the progression of autosomal recessive polycystic kidney disease.
So the research we're doing in the Kidney Flagship with our stem cell biologists is actually trying to create models of human kidneys so that we can better understand what goes wrong in a child that has kidney disease and whether we can find a new treatment for that. We make little models of human tissues, human kidneys in the laboratory that we call organoids, and we use these to really model and match the patient, such as Aubrey, to better understand those diseases and treat them.
In our team, we use kidney organoids to model disease. What this means is we use them to better understand these diseases and then to try and find treatments that can be translated into clinic. These can be novel treatments or repurposed treatments, meaning we use a molecule that is used for a different disease for that new application.
Any new treatment that we discover using the kidney organoids will require clinical trial before it can be used as routine clinical practice. Within the Kidney Flagship, we have access to local resources and national and international collaborations with experience in the design and conduct of clinical trials to complete the journey from new laboratory discovery to new clinical practice.
We know Aubrey's kidney transplant is not going to last forever, so we're hoping through research and through new scientific evidence that we will be able to help kids like Aubrey throughout the future and not having to rely on these medications.
The mini kidneys we can make in the lab are incredible, but they're not perfect just yet. For example, they're quite immature. So we're working on ways to improve them constantly to make them more accurate models of the human kidney so that we can better understand patients' disease, but also maybe develop better treatments. One way that we could do this is to use these mini kidneys to be able to look for new medicines to treat kidney disease and potentially also use them as transplants in the future for patients.
Aubrey's case is one of many varied causes of genetic kidney disease. This is an evolving field, and we're working hard to use complex and data-led approaches to improve our care.
Here at RCH, we've had an electronic medical record for about 7 years now. This means we can approach healthcare in a different way. Currently, we're looking at information in the record to look for children with subtle signs of a genetic kidney disorder called Alport syndrome. By looking for these children while they're well and providing an early diagnosis, it means they can access appropriate genetic counselling, treatment and surveillance. In some cases, this means we can delay the onset of renal failure by up to 10 to 15 years.
Our flagship is a collaboration between patients, families, clinicians and researchers with a vision to end kidney failure in childhood. Many of these people you've met today. The projects that we've described are just a snapshot of the work that we're doing, and we hope to continue to improve outcomes for children today and long into the future, so that every child can live a happy and fulfilled life.